he is considered the person in hypertension. He's made an incredible impact.
He's brought national attention to university hospitals as a center of excellence.
He's really been a transformative figure in high blood pressure research. He's a jewel of UH.
Brilliant and tenacious. When Jackson Wright speaks, everyone listens.
He is the consummate scientist. He is a gentleman. He also is a great friend.
Jack and I became instant friends, and we remained friends over the past 25 plus years. He's a superb person.
I actually grew up in Pittsburgh, Pennsylvania. Had the usual family life, growing up with brothers and sisters all within 3 years of me. Great parents, great support. I've been very fortunate.
Jack comes from a family of people who are very impressive.
When you look at the Wright family, all of those kids have advanced degrees. His mom and dad helped to motivate these kids to really take things to the next level.
So they were expected to achieve, and Jack did not disappoint his parents. As they say, behind every successful man, there is a more successful woman. And his wife, Molly, has really been that for him over his career.
She grew up in Cincinnati and eventually met Jack when they were going to school in Pittsburgh. Molly, who he loves dearly, helped to motivate Jack to achieve. He's a real family man.
The major motivator in me is my family. That support has been there. We have a wonderful daughter.
There's a lot about him that I think people don't know. He got his PhD before he went to medical school.
I always wanted to be a scientist. I always enjoyed science. Started out in the PhD program in pharmacology, drug research. The reason that I got into medicine was because of the fact that I wanted to also be able to extend the studies that I did. And once in the MD program, I found out that I actually did very much enjoy taking care of patients. And that led to my interest in clinical pharmacology. I was at the Medical College of Virginia for about 10 years prior to moving to Cleveland. And it was an opportunity to work with collaborators here who were interested in hypertension bench research, and especially with the focus of studying hypertension in Black and minority populations. And that's what drew me to Cleveland.
Jackson was and is, the consummate clinical trialist, and I would rank him in the top 5 or 10 in the country. Jackson was the pivotal player, if not the leader, of several clinical trials during his career.
The links between high blood pressure, heart attack, stroke, and heart failure have really come out of his very important studies. So if you think about his 2 most important trials, ALL-HAT and SPRINT, that have completely changed the way that we treat and focus on high blood pressure in this country and in the world, his impact has been literally millions of lives.
High blood pressure is the most common serious medical problem in the United States. The one study I think that defined Jackson Wright was the ALL-HAT trial. The ALL-HAT trial compared diuretics, which cost pennies per month, versus the newer medications, which cost quite a bit of money. And there was this push that we should switch to these newer drugs and leave the diuretics behind. And Jack pretty much by himself said that's wrong. Well, naturally, there's a lot of pushback from the pharmaceutical companies because you got these expensive newer drugs. So Jack was like on an island to himself saying, we shouldn't do that. And he took a lot of heat and he held his ground, and the study proved that.
And then he came out with the SPRINT study. And the SPRINT study changed the whole parameters on how you decide whether or not people are hypertensive.
You just asked another simple question. Well, what's the optimal blood pressure that you should treat to? I mean, it seems so obvious, but we didn't really know. Those are very large trials and a lot of patients and cost hundreds of millions of dollars to answer the question, but it literally impacts millions of patients. And there just are very few people that you meet during your lifetime that have had that impact on mankind, and he's one of them.
People didn't know about hypertension. They didn't know how to manage it. We really didn't know what it meant. And now we do. So now people are living much longer, and a lot of it has to do with the work that Jack has done.
You would never know how big he is nationally and internationally. When you say high blood pressure, there may be 3 names that people say right off the bat. One of them's Jack Wright.
Part of his talent as a clinical trialist was, I think, working with and developing young people.
And that's really important. You have to be open to bringing along the next generation. Jack is very good at that.
Been very fortunate here at UH to have some of the best young minds that I've ever seen. And it's been fun working with this talent to produce the next generation. I am hopeful that they will carry on.
Dr. Wright is an extraordinary clinician, caregiver, researcher, and teacher who has spent his life dedicated to the patients who he serves and the important research that will improve the quality of life for millions of people in the years to come.
I enjoy what I do. I enjoy the work and accomplishments that we have been able to produce. And I also have enjoyed the people that I have had the opportunity to work with. I only wish that future generations of investigators can have that same joy. It's been a wonderful ride.